Well, good morning. Thank you all again for joining. I'm Danielle Riley. I am a community services representative with the Department of Family and Support Services, Senior Services Division. I am joined by Dr. Victoria Russo, the supervisor for our Alzheimer's Disease Program Initiative here with DFSS. We have for the last about year and a half been operating our series on maintaining a healthy brain called Brain Health. And if you're joining us this morning, this is part 5, where we will be focused on social connections and health, why feeling connected matters. And we are joined this morning by Dr. Louise Hawkley. Dr. Hawkley is a principal research scientist in the academic research centers of NORC at the University of Chicago. Her research has predominantly addressed loneliness and health during aging. She is a co-investigator on the NIA-funded panel study, which is on the National Social Life, Health, and Aging Project. She continues to work with the Illinois Aging Services to evaluate social isolation programs in the state and leads the development of a national social isolation mapping tool for the AARP Foundation. Dr. Hawkley is also a member of the Scientific Advisory Committee for the Foundation for Social Connection. So we want to warmly welcome her and thank her for her time today and leading us in this discussion on social connections and why it's of the utmost importance to our health. Dr. Hawkley, thank you so much, and feel free to take it away.
All right, thank you very much. I'll go ahead and share my screen. All right. This is the topic that you heard is my redress. This is what I'll be talking about today. So I wanted to start by just making sure we all understand what we're talking about. So if we want to value social connectedness, which we do, we need to know what we mean when we talk about that. And researchers like to have very clear definitions about what they mean by the terms. So we do have distinctions between what social isolation is and what loneliness is. And that gives us essentially the opposite of what social connectedness is. It's this interesting state of affairs to begin with, because there is really no way of defining social connectedness, of having a term for it other than its opposite. I mean, it is what it is because it's so taken for granted that we are social critters. We have people around us. We're always connected to others. It's so important to who we are that we don't even need a word for it. It's assumed. But if you're lacking social connections, there's 2 ways we think about how that happens. One is what we call social isolation, where we're really talking about an objective state. You are alone in some fashion, or you have few contacts, low levels of social contact, like very few people that you talk to, very few interactions with other people. But notably, it doesn't have to be an unpleasant state, especially if you choose it. Like some people like to be alone for the kinds of work they do, or there are times where all of us like to be alone. So it doesn't have to be unpleasant, but it can be, and oftentimes that's when it's most problematic. Loneliness, on the other hand, when we use that term, we're talking about a subjective state. I feel isolated, but you can feel isolated even when there are people around, which is what happens in this. I think there's somebody with a microphone on. So there, you can get with loneliness a mismatch between actual and desired social relationships. That's what we use to define loneliness. What you want and what you get are not matching up. And usually it's in the terms of quality. You don't have the kinds of relationships you need that really fill your need for that sense of connectedness. And by definition, loneliness is an unpleasant state. Oftentimes people feel they don't have a choice, that this is how they feel, there's nothing they can do about it. That's maybe a wrong estimate, but that's how people feel when they're lonely. They feel like they're helpless to change things. So when you measure social isolation, it's difficult to get agreement among researchers on what you use, but typically what is done is people look at all of the social relationships that are prominent in most people's lives. Like they count, are you married or not? Do you have friends and family that you have regular contact with? Do you attend church regularly? Do you volunteer? All of those things are put together, and the more of all of those things you have, whether it's friends, contact, volunteering, church attendance, the more connected you are considered to be on that kind of measure. And the fewer, if you're not married, you don't have friends and family you talk to, you don't attend a church service, you don't volunteer, you're considered very isolated. So in this very large national study, the Health and Retirement Study, excuse me, the Medicare beneficiaries, so those are, most of them are going to be 65 and older, they found that 14% of that population is isolated. This plot, I don't know if you read plots easily, if you care to see it, but you can see there's a cluster. Most people are sort of in the middle of this range between isolated and connected. And then there's 16% who are very well connected, like they're just the social butterflies, I guess you could think of them. They have a lot of contacts, a lot of interactions, a lot of connections. So 14% isolated. What about if you're measuring loneliness? Is this bar in the way? I don't know. Maybe I can move it here. There's something in the way of my screen that I hope isn't in the way of yours. Anyway, so measuring loneliness, or its opposite, feelings of connectedness, is often done using these 3 items, which creates what is considered a standard measure of loneliness. So the questions ask, how often do you feel isolated? How often do you feel that you lack companionship? How often do you feel left out? And for each of those questions, a person will say, I never or rarely feel that way, I sometimes feel that way, or I always feel that way. And you get numeric representations of those values. So if you very rarely or never feel that way, that's a 1. If you get a 1 to each one of these, you rarely feel isolated, you rarely feel like you lack companionship or left out, then your total score across all 3 items will be 3. But if you say you're always feeling this way for all of those items, then you'll be at the very top and you'll have a score of 9. So what we're doing here is measuring loneliness not as an either or, but degrees of loneliness. So people who are very low on this, they never or rarely feel these things, we call them connected. They feel connected. When we look at the National Health and Aging, National Health and Social Life and Health and Aging Project data, we see that we have a distribution. People who score 3 are the dominant group. Most people don't feel lonely by this scale definition, but some feel somewhat lonely and some feel very lonely. And so in general, the kind of estimates we have, if we have to break them into 2 groups, one that we consider lonely and one not, we would say at least 30% are lonely in this 57 to 85-year-old group. These are 57 to 85-year-olds living in the community. They're not in long-term care. They're not in nursing homes. These are just people who are living on their own in their homes. So how much of a problem is this? Well, one way to look at it is not only what it is typically, but what happened during the pandemic. And what you can see here in 2018, 34% felt a lack of companionship. That's one of the items on that loneliness scale. That went up to 41% early in the pandemic. Felt isolated from others, no surprise, that about doubled. Because in fact, people were isolated. They were asked to isolate themselves from others. Similarly, infrequent social contact. They had a big increase there because, again, objectively, they were not supposed to be interacting with people, at least not in a face-to-face manner. So why should we care? One of the sort of founding papers, I guess you could call it there, that really got the ball rolling was a study in 2010 that looked at all the research that had been done up to that point, looking at how social relationships related to mortality or to longevity. And in this plot where I've summarized some of Julianne Holt-Lundstad's findings, you can see that people who had very good, what we call functional and structural relationships, meaning they had good supportive relationships, they had strong support in the nature of the kinds of people they had around them. It wasn't just a spouse. They also had friends, family, a minister, maybe a volunteer coordinator. They had a range of really good relationships. They had a much better survival rate over a follow-up interval than those who didn't. Similarly, those who had some good high quality ties, so the ties that were most rewarding, you could say, or satisfying, were the ones that generated the biggest survival advantage. Compare that to some of the things we know are related to mortality. Light smokers have better survival than moderate smokers. Those who stop smoking have better survival than those who continue smoking. Those who are lean have better survival than those who are obese. All of those effects are, in some cases, even smaller than the effects of having good relationships or conversely poor relationships. So it drove home this fact that there is an ultimate cost to having poor relationships. Another study 5 years later looked at specific types of isolation. So loneliness, which is felt isolation, living alone, which is a form of being isolated, and then social isolation, which is this composite measure that I was talking about earlier, where they take all kinds of aspects of your social life into consideration. And although these bars look a little bit differently, they're essentially the same. So every one of them is now predicting greater odds of mortality. So the bars are now pointing to the grave rather than to survival. So plenty of reason to think that this matters. So that at the same time, a lot of research has gone into what's going on in the human body that might be what drives these effects on mortality or longevity. And we know by this time that loneliness increases risk for hypertension, for myocardial infarction, otherwise heart attacks, increases the risk for stroke, for diabetes, high cholesterol. All of these conditions are derived or affected in some degree by chronic inflammation. This is one of the common features of a lot of these diseases of aging typically, but they're also more prevalent among people who are lonelier than those who are less lonely. Cognitive health. When you're talking about brain health, this is a very clear demonstration of how social relationships are important for brain health, because people who are lonelier develop cognitive impairment earlier in life, their cognition declines more quickly, they're more susceptible to dementias. Again, all these are diseases that come about in part because of inflammation in the body. Of course, there are mental and emotional health tolls, expenses to be paid. When you feel lonely, you just don't feel good. So lower well-being in general. But beyond that, loneliness tends to elicit feelings of anxiety and depression, not only depressive symptoms, mild depressive symptoms, but to the point where you can develop clinical depression. Suicidal ideation. It could be because of the depression, or it could be directly because people feel lonely and there's no reason to feel like you want to engage in life anymore. Susceptibility to elder abuse. People who are lonely, perhaps because they are hungry for connection, are going to accept connection in forms that are perhaps not good for them. And they may be more vulnerable to and not as likely to speak up against instances where they might be vulnerable to other people's taking advantage of them or outright abuse. Loneliness and health behaviors. So here's another place where loneliness takes a toll. We know, for example, that loneliness is related to poor sleep quality. You can sleep the same amount of time, or think you do, as a non-lonely person. But if you're lonely, that sleep quality is not going to be as good. In many of the studies that I've been involved with, we see that lonelier people have more frequent awakenings, what they call micro awakenings. You might not even know that you're awake, but you're not sleeping soundly. If you know your sleep cycles, you're always sort of at the cusp of waking up. And so you'd wake up feeling less rested. And sleep, of course, is a big deal for health consequences at any age, but also in old age. You see among lonely people that they're less physically active. That itself isn't good. I mean, little Einstein here says E equals MC squared. Here's a new definition for you. E, if you're elderly, you've got to move constantly, also known as move it or lose it. In fact, when you don't move, that is one of the risk factors for developing a disability, just becoming immobile. The less movement you make, the less active you are, the less active you will be able to be going forward. So that's another way that loneliness takes a toll on people. It tends to decrease perhaps their motivation to get involved, to get physically active. People who are lonely tend to be have higher rates of smoking, less likely to stop smoking. They're less adherent to nutritional recommendations, so they won't eat the quantity of fruits and vegetables that they should be having for a healthy diet. All of that really came home just before the pandemic struck, which was something that was published by the National Academies of Science, Engineering, and Medicine. This is a big deal. This is a publication that took everything that they could glean from the country in terms of the kinds of research that had been done and concluded that this is a big deal. We need to do something about it. And this particular book, it's several hundred pages, set it up as opportunities for the healthcare system. People in the healthcare system should care, and here's what they should be doing to help tackle this issue and its health consequences among older adults. So you might ask, and even if you don't, I'm going to tell you that there are certain risk factors for loneliness, certain ways, certain types of people or certain experiences that set people up to vulnerability, to feeling lonely. And I think I've already said, and I'll just remind you that just being alone doesn't mean that you're going to be lonely. People differ in how much connection they need to feel satisfied. And so for a person who's extroverted, they might need more people, but for a person who's introverted or shy, might be happy with just one really good person to stave off these feelings of loneliness. But there are other factors. So we know, for example, that people with poor quality relationships are lonelier than those with high quality, regardless of the number. The quality matters a lot. We know that loneliness is prevalent in assisted living and skilled nursing facilities, more prevalent than it is in the general population. We know that loneliness is more prevalent among functionally limited or disabled individuals. If you can't get out and socialize, and if you can't even do well within your own home, that tends to make you feel lonely. Widows tend to be lonelier than married individuals, but that isn't, forever and ever. Widows who remarry will ease a lot of that loneliness. And the loneliness is also dependent on how long people have been widowed. So if you've been widowed for 5 years, you're probably not as lonely as you were when you had been widowed for 1 year. We know that loneliness can occur in a marriage. Just because you're married doesn't mean you won't be lonely. It is true that on average you will be less lonely, but there are definitely circumstances in a marriage where, let's say, we've done research where we show that if your partner is not supportive, at least not as supportive as you would like or need, and if they're very demanding and maybe critical of you or nagging, that creates a climate where you will feel more lonely. Even though you have a spouse, you will be lonely, lonelier than somebody who's in a marriage where they feel their spouse is a reliable confidant, somebody with whom they can share important things and get a listening ear. We also know that there are other contexts that make a difference for loneliness. This is a rather busy slide right now. I'm trying to parse it into groups, but what I'm doing here is showing you data we collected from Chicago, some neighborhoods. There are 10 select neighborhoods in Chicago where we tracked older adults with smartphones, asked them to tell us how lonely they felt, where they were. So we pinged them on these smartphones, and the questions were, where are you now? How are you feeling? Who are you with? And so on. And so what we're showing you here are 2 times we went to this group of people. Once was before the pandemic in blue, once was during the pandemic, which is orange. And what we're looking at here is comparing people to when they're at home and alone, which is the most lonely state that people were in. What if you're at home, but you're not alone? Well, before the pandemic and during the pandemic, that helped ease loneliness. So these are decreases in loneliness from 0 line, which is no change. So having somebody with you was helpful. Maybe not as helpful during the pandemic as before, but definitely helpful. What about if you look at people who were not at home, but still alone? They got outside the house, but they were still alone. Well, at least during the pandemic, that was also helpful. People felt less lonely when they were outside the home. However, during the pandemic, being outside the home and alone really didn't make any big difference compared to just being home and alone. You could argue that that's because during the pandemic, being home and not being home, you were alone in both circumstances, essentially, because you weren't supposed to be interacting face to face. So it didn't make much difference during the pandemic. But then what about the complete opposite? You're not at home and you're with other people. Whopping big difference. Again, much less during the pandemic, but you see this big difference being outside the home. So this tells us something about what contributes to loneliness in older age, and that is there's just a physical context, whether you're home or not at home, somewhere out and about. During COVID, we saw, and this is another way of thinking of risk factors, it is a risk factor to have this experience of social isolation. But what you see here are the 3 items of the loneliness scale. Lacking companionship, at least sometimes, 2015, 2020, virtually identical proportions of people felt that they lacked companionship, at least sometimes. Pretty much the same effect, in fact, maybe even fewer during the pandemic, felt left out, at least sometimes. The only difference really was feeling isolated, where during the pandemic, it was much higher, a higher proportion felt isolated than did not. Again, not surprising, because during the pandemic, that word isolated defined what people were doing voluntarily or involuntarily. So they did feel isolated. I'd also point out that this was not in their control, and the fact that people didn't have control over their social circumstances is itself kind of loneliness making. However, I'll also point out that on average across these 3 items, there's not a big difference between 2015 in the blue bars and 2020 in the purple bars. And that again points to the difference between objective isolation and subjective isolation or loneliness. You can be alone. That doesn't mean you're going to be lonely. We also asked whether remote social contact could replace in-person contact to protect mental health, to protect against loneliness, for example, in older adults. And by remote social contact, we were thinking of all of the encouragement people were getting to use video calls to get some kind of face-to-face contact, and that should help them feel less lonely. Well, here what we have is our National Social Life Health and Aging Project people telling us whether their in-person contact decreased, increased, or stayed the same. What I'm showing you are people who reported that their contact with family, in-person contact, had decreased, were more lonely. If they increased how often they interacted with their family by phone, it's a positive number. It's not what we would call a significant change. It had very little effect on how lonely they felt. Increasing messaging, so that's emails, instant messaging, even Facebook messaging, didn't really have an effect. What about more video calls with family? What everybody had been touting, this is what you should be doing. It had very little effect on how lonely they felt. The big whopping effect in this case was the cost of decreasing in-person contact. That's what increased feelings of loneliness. And the same pattern, well, that's not going away, so I will just take that away. I'll just say that that was the same effect that we saw for friends, what is covered over here, and I can't clear out. So what we're seeing here and in the final analysis was that it didn't matter how much of all of these other modes of contact you had with family or friends, it was not enough to compensate for how much lonelier you felt without the in-person contact. That's not to say that remote contact is useless. It does play a role. It does help to some degree, and maybe in some circumstances more than others. For example, having contact with people who are going to be nagging you about, wearing a mask, did you get your shot? Whatever it might be, could perhaps be as costly as not having a call at all, not having anybody to talk to. So you want to know that there's a place for the remote contact, but you have to know how much, what kind, who does best with certain types. Some people might do better with phone than video calls. Some people might like messaging more than video calls, that kind of thing. That's all something that has surfaced as an issue that we don't really understand yet. Plus the fact that older adults are changing how they're using video calling and messaging. That's beginning to become more prevalent, and we have yet to see whether that might have a positive impact in the future. So I also then wanted to tell you about interventions. What do we know about ways that you can improve a sense of social connectedness? And I start here with a who cares. This has become an issue not only for the National Academies of Medicine, but also the United Nations. We are in a decade of healthy aging, and the United Nations is focusing very much on social isolation and loneliness as part of what it means to get to healthy aging, meaning we want to do away with or we want to minimize social isolation and loneliness because it has serious health consequences. I might add that I am just as concerned about social isolation for its emotional effects as I am for its physical effects. If you feel like life is of low quality because you don't have anybody to share it with or anybody to support you, that's reason enough to make that a focus of healthy aging. The Illinois Department of Aging, some of you might know this, with Governor Pritzker taking over in 2018, the Illinois Area Agencies on Aging got a budget line to improve the range or the types of programs they offered that would specifically address social isolation among older adults in their areas. So the Illinois AAAs, as we call them, have been collecting loneliness data since before the pandemic started. And I was part of a study together with CJE, Senior Life, to evaluate how these programs changed during the pandemic and who participated and what kind of effects they had. This was itself a bit of a challenge because we started this study before the pandemic, or we were going to, and then suddenly nothing was the way it had been and had all changed. And I'll have to say that the area agencies on aging were just laudable in how creative and quickly they pivoted to make sure that they had programming for older adults even during the pandemic. Here's an example of what we found. In Age Options, the suburban Cook County Area Agency on Aging, they introduced a Uniper program, which a Uniper is, as it says at the bottom here, a digital health service. So what you get is sort of a customized screen television, if you want to call it that, and you can do a lot of things very easily through this interface because it's designed specifically for older adults and their family and doctor and friends. So you can have book club meetings very easily. You can see everybody who's in your club and have your meeting. You can interact with your doctor. You can talk to your family. It's wrap around in just about everything you want to do with a person you can do on a screen with this service. And what we saw here was that when people entered the program before they had started using Uniper, their loneliness score averaged about 5. And at follow-up, this was anywhere from 2 to 6 months later or 8 months later, that loneliness average had dropped to 4. So that's very encouraging. A whole point on a essentially a 3 to 9, 6-point scale or 7-point scale is a very good reduction in feelings of loneliness. So that's encouraging. For researchers, it's nice to have that information because then it lets the people who are developing these programs know that this may be a good place to invest. There are a lot of things people try that aren't necessarily effective, and then you have to ask whether it's worth continuing, or more importantly, whether it would work, but in a different type of population. Other things people have done, joint interventions, so 2 at once. Silver Sneakers, some of you might be partakers in Silver Sneakers program. And in one study, those people who were eligible were either enrolled or were put on a wait list for 6 months. And the people who were enrolled were more physically active at 6-month follow-up, not surprisingly. I mean, you're in Silver Sneakers, so you're going to be more physically active. But not only that, they reported being less isolated and less lonely, in part because enrolling in Silver Sneakers kind of made them engage in a social context where they were being physically active with other people, and that makes for feeling connected. So that was a nice demonstration. There was another one that combined nutrition and isolation. So in this case, you have Meals on Wheels programs. There were 8 of these studies across the country that were part of the study. And they were, the older adults on those waiting lists were randomly assigned to receive meals. Some did, some didn't, for a period of time before everybody did. And what they found was that at 15 weeks, those who received meals were less lonely, probably because they had a person who arrived at the doorstep and chatted with them. It wasn't only a delivery, it was actually a social exchange. And even more supportive of that rationale, there was what we call a dose response. Those who received daily meals had the best reduction in loneliness, much more so than those who received only weekly meals. So there's something about more of these social interactions may have been the protective aspect of the Meals on Wheels. And I think we all know, I mean, if we want a social event, the way to get people to come, the way to get people happy is feed them, right? Eating together is a great experience for feeling connected. There are other ways. You can volunteer. In examples that I know of, for the purposes of this presentation at least, there is something called Experience Corps that was started in the 1990s that pairs older adults in the community with 3rd and 4th graders in schools. The idea initially, and for where it's still active, and there are, I'd say, a dozen or so cities across the country where that program exists, the kids need remedial help with reading. And the older adults are committed to spending anywhere from 10 to 20 hours in the school with these kids, helping them. And although the initial reaction on the part of kids and older adults was, I don't know about this, especially the kids, like, why would I want to have this old person talking to me in the school? You know, they were doing what kids do. Those kids formed really close relationships with the older adults and vice versa. And the win-win was evident for both groups. Kids had much better behavior in the schools, much better performance, better reading, better school performance as a result. So the principals were happy. And the older adults got more physical activity, just having to, let's say, get on a bus and get to the school, be with the kids. They reported less loneliness. This activity and the engagement actually made itself clear also in the fact that they could reduce the number of medications they took. In essence, they became healthier as a result of this engagement with kids. So intergenerational programming, which I'll come to here. There's another one, Generation Exchange, that's in California, and it's based very much on Experience Core, but right now it's only in California, but it has some very similar properties, not entirely voluntary in that they do provide a bit of a stipend to the older adults to help in the schools. Something that I think is worth keeping an eye on if you ever want to get involved in something like that, because the schools are definitely in need of help in the classrooms. They're suffering loss of staff and they just need that kind of help. And so if the school district will support it, this would be a nice thing to look for as an opportunity to participate in a meaningful way. Intergenerational programs take other forms, and I'm using here an example of shared housing. We see this a lot in Europe, but it could happen here too. There's no reason why a woman who lives alone in a 100-year-old house that's 2 stories and big and dusty and airy and cold needs to be there alone necessarily. It's possible to share housing, and there are examples of college students, for example, looking for housing that's affordable, but they're also willing, that the tit for tat here, they're willing to help out around the house. So if a person they're living with needs help carrying the groceries in, or needs help cleaning, or whatever it might be, maybe it's just socializing. It's a way to bring generations together that benefit both, and benefit in the sense that there's an anti-ageist aspect to this. There tends to be a dissolving of the stereotypes. So the older adult no longer thinks that the teenager or the kid is beyond comprehension. They're just so lost. They're people, and the younger people may have their first experience with an older adult. In a lot of cases, older grandparents live far away from the nuclear family, and they don't know what it's like to have an older person around. And this gives them a view into the life of that person, and they become very human. Group activities, chorale singing, church attendance, that's a group activity and participation. Also participatory arts. And I will just mention that one study where they looked not only at how people were spending their time, like whether it was alone or not, but whether they were doing creative things. So this is adults from a large age range, from young adulthood to older adulthood. They felt lonelier on days when they spent more time alone. And then a big but. If when they were alone, they spent their time doing creative things, arts and crafts, it didn't bother them. They were less lonely. So I think most of you who are artsy, craftsy types and get into that space will appreciate that that's a very fulfilling time, and it doesn't require, it may in fact not be good to have other people around. You really enjoy your own company in those circumstances. Here's an example of a site, and this is where, I can put some websites in chat for you in a moment, but this is another example of an organization that helps provide opportunities essentially for people to engage, and you'll be able to find things that you can do through here, and I can offer that to you in a moment. I wanted to show you a few things. I'm going to have to go out of this mode. So Make Room at the Table is a Chicago startup. Marcia Slater Johnston started this, and every year they send out a holiday list of how to not feel lonely during the holidays. This particular list is for what to do if you're spending your holidays on your own, and there's 6 points here. Curl up in a chair, absorb yourself in a book, treat yourself to a nice dinner, cook or order a traditional holiday treat, and so on. And there's also a page, how to help others. How do you reach out to others who are going to be alone? And a list of ideas for that. So as I say, I'll leave some links for people to look at that later. There's also, some of you may be familiar with the publication Next Avenue. There was a feature article, how to be less lonely this holiday season, recently published, and about halfway down here, simple ways to connect. Here's the food thing again. Meals are so important. Bring a meal, but don't just drop it off. Stay if the person's willing. Have a conversation. So that's another way. There's also the National Resource Center for Engaging Older Adults. And here too, you can find examples, tips for supporting your social connections and emotional wellness, events, social engagement and mental health, a webinar, and so on. So there's those. In the city of Chicago, the sponsor here of this talk today, you can go and find on the DFSS website, senior services. It doesn't have to be all about social to make people feel less lonely. It's any service that's provided that reassures people that they're not invisible, they're being seen, there are programs for them, and they can be in anything that an older adult might need, from legal help to finding new housing to finding out where to get the latest booster, whatever it might be. In the case of age options, you get this kind of a website. Each agency in Illinois has one, and it provides too, how can we help? Programs and support services, and you can get a long list. Improve your health and well-being. How about providing support for caregivers? How do you connect with your community? There's a lot of programs that can be found offered by each of these. This site, and I'll put this in the list too, is simply a site that defines each of the areas, the 13 areas in Chicago. You find the one that you live in, and you can find out what services they are providing. So that's that part. I will want in there so we have a little bit of time to talk about anything you want to talk about in the way of questions. So I will end here just thanking my supporters and opening the mic for everybody else. Or Danielle, you want to monitor how this goes?
Thank you so much, Dr. Hawkley, for sharing your wealth of knowledge and experience in this area. So we will now open it up if you want to use the raise your hand function or throw questions or comments in the chat or just unmute. We have some time for questions.
I have a question about the commentary about loneliness is prevalent in assisted living facilities.
Yeah.
You know, any commercial you watch, you'd think that life is a big party in an assisted living facility, and you know, life couldn't be grander. I just wonder, and the spirit of it is that you bring people together who need help or want that community feeling. Any thoughts about what could be being done better there? What the cause is of a feeling of loneliness in that setting?
Yeah, it's a good question. I was reminded of a publication, New York Times published this piece where a woman writes about her 90-plus-year-old mother finally relenting and saying, yeah, I think I better move into assisted living. And she moves in and sees there's a bridge table and they're missing a person. And she offers to play, and they basically tell her, no, we don't want you to play. You're not our usual, you know, you're an outsider. We don't need you. So it doesn't matter, playground at 3 or assisted living at 93, we still have, unfortunately, people who will close their minds and their hearts to new people around and make it really difficult. So I don't know if it's in that case, if it's something so much that an organization can do, although I'm sure there's something they could do, as it is just human nature. But I think the other thing to remember is that what isn't working for some is working for others. And it's like a lot of the interventions we have for loneliness and social isolation. There are so many idiosyncratic needs that people come in with that you can't expect it to work the same and equally effectively for everybody. And I think the secret is to understand where are the niches, the needs not being met. Are there other types of activities? Are there other venues? What is it that is good for some, even though it might not be good for everybody? Can we find a way of diversifying and making sure that those idiosyncratic needs have a way of being met? That's about where I am with this right now. Chelsea mentioned senior bullying. Yeah, that was kind of an example of it there. And there are other examples. It's not, I think of the work I did with the armed forces, and, these guys go out in their unit and they're not family. They don't know each other, but they're stuck now with this group of guys, this platoon, and they have to make the best of it. And sometimes it's easy and it all clicks and it feels great. And other times it's a real battle and it can make you feel worse rather than better. And that's one thing about assisted living. You didn't choose this family. You're kind of stuck with the people you now have living with you. And you have that too when you're living in a community and you have neighbors in the next house that maybe are great neighbors or not. But in an assisted living facility, it's just that much more ever present and imposing on you. I think Ashleigh has a question.
Feel free to unmute, Ashleigh.
Yeah, thanks. I actually didn't have a question. It was more of a comment on loneliness in assisted living. I actually just completed my dissertation on this exact topic. And I think when we're looking at loneliness, it is our perception of our relationships and being a part of our preferred relationships. So even when we have residents who are super engaged and they go to every single social event that there is, they can still experience that loneliness because it's not the relationships that they want or the relationships that they're prioritizing. So I think where we get some of that, and one of the things I found to be really interesting was that every person I interviewed was like, yeah, we know about the activities. We know about the schedule. I don't want to do that, or I do want to do that, or I'm not a social person. So those personality traits still hold true as well. So that was just some of the feedback that I wanted to provide on that piece of things. So thank you.
Yeah, that's great. Thank you. Timely. Aileen?
Hi, good afternoon. Thank you so much for sharing your insights with us, Dr. Hawkley. So you were talking about mentally, emotionally, and also perhaps physiologically, the susceptibilities that, of course, vary from person to person when it comes to loneliness.
Mm-hmm.
Can you share some examples of when loneliness does not have a negative impact?
Well, anything we study is, this gets maybe a little more technical than you need, but we're always talking about average effects across a large population. So there's always variation. So on average, loneliness is going to have this bad effect. For some people, it's very bad. For some people, it may be minimal. So there is variation. And what do we know about what causes that variation? Why some would be damaged and others not? Could be, in the case of physiological signs, we try to control for this, but other health conditions that are going on. So if they've already pre-existing health conditions coming into older age, and then you stack loneliness on top of that, all these different foundations on which this loneliness is building physiologically could contribute to differences. It could be genetic susceptibilities that are amped up in the face of loneliness. If you don't have the genetic susceptibility, maybe you don't have as serious an effect. So we don't know a lot about that yet, but there definitely is variability.
Thank you so much.
Mm-hmm. Becky has her hand up.
Mostly because I have to learn after this how to raise my hand virtually. Thank you for your presentation today. This morning, there was a really interesting piece on NPR that was done about the youth ambassador for reading and literacy on the federal level, connected with the Library of Congress. And he actually requested a third year because he felt it's normally a 2-year post, and he requested a third year because he felt that he had not made enough in-person connections with children and youth. And I just thought that was very interesting and a good example about being able to follow through on an assignment that really was an in-person assignment. And at the end of it, he said that he thought, and these are truly my words here, that one of the things that was more important than reading was basically children's will to live during the pandemic. And I am wondering what studies are out there that are longitudinal studies or that you're looking at that are really measuring children and youth now that will have results, after we're gone.
Yeah. I study primarily older adults, but certainly I've had exposure to studies where they are looking at younger people. And during the pandemic in particular, I think Ad Health is one such example of a study that continues to bring in adolescents and follows them through into later life. Certainly all the studies that, I don't know how long they'll be going on, but the studies that exist to this point, it's clear that children and youth in particular, here I'm thinking teenage years more or less, are suffering quite phenomenally, and in the sense that there are serious mental health problems. There are problems with suicidal ideation, if not actual attempts. So it is definitely worth keeping an eye on that and understanding what it is that can be done, learning what it is that can be done to alleviate that. Just as a point of interest and a contrast, I would have thought initially that the state of isolation that was imposed would have been rather devastating for older adults, particularly because they would have been more likely to seriously isolate in the face of the greater risk they had to getting sick and getting seriously sick. The other hypothesis I had, and which was the basis of a research study that I started at that point early in the pandemic, was older adults are a resilient bunch. They've been through a lot. And, this is just another such thing. And when you look at things like loneliness, older adults, as I showed you, didn't really show much of a change. That is not true for younger adults. They showed a big change, a big increase in loneliness, anxiety, depression. And the explanation for that may or may not be the greater resilience of older adults. The reality seems to be that for younger people, they got hit a lot harder, not just with isolation, but having to deal with homeschooling, having to deal with the loss of a job, having to deal with perhaps taking in new people into their house or having to move in with mom and dad or something like that. They experienced a lot of stressors, a lot of reasons to feel disconnected out of their usual sense of who they were and what their world was about. And so I think there are a lot of reasons to be concerned about the younger people. And maybe that's a good reason for older adults to step up and be there and be the voice of experience and reassure their younger peers, whether it's family or friends, that, this too will pass and I'm here for you, whatever that might mean.
Oh, thank you for sharing that. You mentioned the experience core, and I know like through DFSS, we have the senior core, which are the, AmeriCorps funded programs. So there is the foster grandparents program that goes out into the schools in the same capacity to that intergenerational aspect of working with the younger people.
Oh,
So,
thanks for that reminder. That's great.
yeah, that one, and then the senior companion program, but FGP is very much functioning well at DFSS, and a wonderful bunch of individuals who are volunteering to provide that aspect of mentorship and, really connecting with young people in the CPS school. So just wanted to add that. And also the fact that you mentioned Uniper. I have done programming on Uniper before, and I was like, oh, this is pretty awesome that people across, the country can like just hop on to this device, and they have the microphone ability to be able to connect to programs right from the comfort of their home. So even in the wake of all that had transpired, the aspect of having technology and different things advanced to manage to connect people, even outside of it. I remember my family, I forget the name of the app, but there was like this little app we would all download, and we can get on there and play games and stuff on it, even when we weren't able to meet. So lots of, things folks just tried to do to stay connected, even when you couldn't, and just what that meant in the longer run. But any other final thoughts or questions for Dr. Hawkley? Well, with that, we thank you all so much for joining us this morning. This call or this discussion has been recorded. We will follow up with it later for you to view in the future as well and share with others. And also we'll be following up with our link to our post test, but we appreciate you all so much for taking time to join us. And we so thank Dr. Hawkley for allowing us some of her time to share on this topic, which was really important. So happy holidays to all of you. Be well, take care of yourselves, and we'll see you next time when we come back to Brain Health.
All right. Thanks all. Happy holidays.
Thank you, Dr. Hawkley. We appreciate you.